Welcome to Journey to the Sunnyside, the podcast where we have thoughtful conversations to explore the science of habits, uncover the secrets to mindful living, and of course, inspire your own mindful drinking journey. Today, I'm excited to have Dr. Christine Boev on the show. She comes out of critical care nursing, went on to a PhD, taught as a nursing professor, and now coaches women through her program, Master Menopause. In part one, we're keeping it practical. What really shifts after 35, which symptoms are common versus not, why chasing fat burn with stressy workouts can work against you, the partner playbook that actually helps, and the basics of hormone replacement therapy so you can have a better conversation with your clinician. Christine, thanks for coming on today.
Absolutely. Thanks for having me, Mike.
Yeah, I'm excited to get into this conversation. And when we first started talking about doing this interview, you mentioned that you were actually a listener of the show, and which of course I'm going to love to hear that. But I'm curious to know, what's it been like to hear these conversations on this podcast from your perspective as a clinician and a coach?
Yeah. So what I love about your podcast is there's such a good variety of topics, related to all parts of living your best self. And then the relationship and the role of alcohol in people's lives. It's so important because it's such a powerful factor that's out there that isn't addressed enough. So I love the spotlight on the role of alcohol and just how we live and how we function and how we try to thrive, whether you're using it or not using it. It's like, how do you function at an optimal level?
I mean, that goes straight to my heart, obviously, because this is a passion project. And, I couldn't help but to ask that before we get into all the wealth of information that you're going to share with us today, just simply because I love having conversations with listeners, and I like to hear their thoughts, their perspectives, and your professional perspective as well. So thank you for sharing that.
You got it.
Well, let's get into today's topic. And I always like to start with a story. So give us a short version of your path. You went from ICU nurse, professor, certified health coach. How did that journey lead you to focus on women 35 plus and menopause health?
So I took my own personal journey and what I struggled with as a female going through perimenopause, going through menopause, and just that struggle and that sense of like, what is happening to me? How do I fix it? How do I do life so that I can really thrive and have an optimal health span? And I was a guinea pig, an N of one, to really use my background as a researcher and as a scientist to say, okay, I'm 40 years old. I'm 20 pounds overweight. I feel like garbage. I don't recognize myself. My energy level is in the toilet. Like, what's happening to me? And what do I do about it? So I went on a journey to figure this out for myself. And now I teach women what worked for me, but also what is backed up by science that tells us, okay, if you're a female going through perimenopause and menopause, this is what you need to do if you want to have excellent health span. And I think that's the word I keep coming back to, because it's not just about looking good and wearing a bikini, but it's about quality of life as we get older so that we can fully contribute to society. And that's my mission. That's my goal, is to help as many women as possible feel their best.
I mean, I can connect in so many different and similar ways in that you went through this struggle in your life and you kind of had to figure it all out. And it sounds like your new mission is to really take all of that struggle that you had to go through and be able to pass that on so that others don't struggle the same way you did and have a quicker path to outcomes that are positive.
Yeah, absolutely. Women come to me and they're so discouraged and they feel this sense of embarrassment, shame, like what is wrong with me? And what I'd love for all of your listeners to know, women, whoever, like there's nothing wrong with you. This is life. This is our physiology. But you don't have to just roll over and accept that you're not going to feel like yourself anymore. There are very specific things that you can do that aren't crazy that will help you to find yourself again and regain that vitality and that youthfulness and energy that really tends to fade away as your hormones shift the way that they do, starting at the age of 35, really.
Yes. And something you said there that I want to get into for a minute, which is there's nothing wrong with you. Is that something that you find that you really have to flip the script on with the people that you work with?
Absolutely, because they feel like they're broken. That, when we're younger, we can kind of eat whatever. And as long as we move enough, we'll stay within a certain, metabolic set point. When you're 18 to 30, your weight doesn't fluctuate all that much. And, if it does, maybe you can go to the gym a couple times and everything feels better. When you are in your late 30s, early 40s, that all changes. So you feel like, well, wait a minute, like I'm doing everything I think I'm supposed to be doing, but everything in my body composition is changing and I don't recognize myself. What's wrong with me? And the truth is, guys, there's nothing wrong with you. You are perfect the way you are, but your hormones are changing and we've got to work with your biology, not against it. So the stuff that you used to do, it's counterproductive at this point. And that's what a lot of women don't understand. So they're embarrassed, their self-esteem, their confidence, all of that is, really at an all-time low. And I hope my goal is to offer that hope, that blueprint, that insight of like, well, no, you're fine. Like this is just what you need to do differently.
So well said. And you know, one thing that I read in looking up about your work is something around reclaiming health and wellness. What does that actually mean? Before we get into sort of more of the detail, but what does that actually mean in a day to day life?
So to me, reclaiming health and wellness is feeling good in your own skin, feeling like you've got energy to get through the day so that you're not, depending on, energy drinks and naps and substances to try to just help propel you through. And instead of just getting by, you're actually thriving and enjoying your life. We've got this one opportunity to be on this earth. You better enjoy it and you better take advantage of it and not take things for granted. And so many people are just going through the motions and they're not really living. And to me, that's a shame.
Yes. And something you said there is a direct link between finding ways to cope and finding healthy ways to cope. Which one do you do? And of course, the topic of this podcast is around alcohol and mindful drinking. And we're going to get into that as well, because that is something that you see a lot is coping mechanisms with the women that you work. But before we do, because we do have a lot of men listeners, and I want them to kind of be thinking about this as they're listening to the conversation that we're having. What's something that men often misunderstand about their partner when they're going through this stage of life?
One of the common misunderstandings is as a male or as a partner or a brother or whatever, that you're the cause of this or you're doing something wrong. And that puts a strain on your relationships. So as men, just understanding how nature works, how your physiology works, and like not beating yourself up over it. If your wife normally has a very pleasant temperament and all of a sudden she's kind of nasty, probably not anything that you're doing. It probably is what's happening with perimenopause and menopause. And we weren't talking about it. It was like, deal with this. This is part of life. And, you'll get through it. And now the conversation, the spotlight is on, wait a minute. Like, you don't have to suffer through this beautiful period in your life now. You can actually live better. But making sure that your partner, your brother, whoever understands what's going on and that it's really not about them. It's just what's going on internally. And be as supportive as you can be with, you know, just under having that knowledge.
Yeah. I mean, I like that this conversation is just being had not just between women. Like, we're sitting
Mhm.
here talking about
Yeah.
this. I'm actually thinking about these things. And in our household, we don't put anything like in a shame zone,
Mhm.
maybe how historically it'd just be something that was swept under the rug and not talked about. But, one of the more difficult things for me is to know how to be supportive versus how to be proactive. And am I overstepping or not doing enough? And so I'm by nature just a very like, let's take this on proactive kind of guy. But what are things that men could do or partner could do that actually does help?
Be a good listener. Women need to feel heard. And a lot of us, we're wives, we're mothers, we've got multiple competing responsibilities. And oftentimes we just want to be heard. So if you can be a good listener and be empathetic and compassionate, and then ask, like, what can I do to support you? And their answer is probably, I have no idea. Right. But maybe you're listening to this podcast and you're like, hey, why don't you go listen to Christine? I think she might be able to like offer some insight. That's a great place to start. But they just want to be heard. And that is simple thing, right? Close your mouth, open your ears, and just be present and listen. You will get a lot of information.
That's great advice. And as I'm getting, more mature in my age, I don't even want to say more mature. As I'm growing older, I'm learning to be a much better listener than I was. I don't even like to think about how I used to be. But, what's one thing that we probably shouldn't be doing?
Shouldn't be doing just for men.
Yes.
Yeah. So offering judgment, throwing in your 2 cents probably where it doesn't belong, and just trying to solve everybody's problems. It's again, we want to be heard, maybe offer a couple resources, some opportunities, but for the most part, just don't be the person that's like, "Oh, hey, like you should try this or you should try that." Cuz at this point, women don't know what they want, right? But they know there's something that's not right.
Yeah, that is such good advice because I do think that problem solving angle, like I mentioned, is something that many of us default to. But I think, yeah, it's just being informed, being supportive, saying it's okay to be how you're feeling, and probably like we're gonna figure this out. You know,
Absolutely. And the other thing too is like there's a lot of weight gain that happens during menopause, and probably pointing that out would not be in your best interest as a partner. So again, gently empathetic, supportive, but we know we don't need you to point it out for us.
yeah, I think that that's probably general advice for like the entire male population there.
Absolutely.
So just in general at any age. So, but let's get into this a little bit more because you are an expert. And so let's just talk about hormones for now. So what shifts hormonally after 35 that more women and men should understand?
Yeah. So there's four big hormones that you should care about, regardless, male, female. The first one is testosterone. So, you hear about testosterone for men and low testosterone for men, but testosterone is equally important for women. That hormone is the first to start to decline. So, in your early 30s, your testosterone will naturally start to decline. Once you hit 35, and this is young, nowadays, like 35 is very young, but your body doesn't know that. So at 35, the amount of estrogen and progesterone that you start to make starts to go down as well. Testosterone and estrogen are very thermogenic, meaning they help us to burn calories, they help our metabolism, they help us to maintain muscle mass. Those are big, right? And so once those start to decline, that's why we'll start to notice, really the first thing you'll notice is maybe a little bit more fluff around the midsection. My pants don't button as well. I'm just not as comfortable in my skin. So the fourth hormone is cortisol. And cortisol is your stress hormone, your fat storage hormone. And when you're a female, 40s, and you do some of those like high intensity activities like running, sprinting, stuff like that, that is going to cause spikes in your cortisol that is going to tell your body to store fat. And that's one of the big mistakes people make is they're like, "Oh, I'm gaining weight. I better like go run more or sprint more or something like that." And it's actually the opposite. You don't want to do things that are going to cause your cortisol to go up and store fat. So, everything is shifting as we get older, but those are the four that really you're going to notice physiologically and they're going to make a big difference in how you look and feel.
Yeah, that makes sense. So, one question that comes to mind is that the conversations I've had so far, it seems like it's like not a one size fits all sort of scenario when these changes begin. And like for a man, a lot of the times it's just go get TRT, and that's sort of like that's the answer, and there you go. And the men are like, I feel great. Obviously, if there's underlying things, then that's not going to be the straightforward fix. But it does more or less seem like it's quite easy for men. Is it much more of a complex issue in this transition phase for women?
It is because of historical research that has put people kind of against hormone replacement. So let me back up for just a second. Men, the way that you go through, they call it andropause. I don't know who made up that word, but your testosterone, it just goes down very gradually over time, right? It's just a nice slow roll. You don't really notice it a lot until you get older. And then now we're talking about supplementing with testosterone to keep you at, physiologic optimal levels, which I think is great. What we know is if you do that, you're going to live longer, you're going to feel better. Like, I think that's amazing. And nobody argues with that. The problem with women is there was a study that was done in the early 2000s called the Women's Health Initiative. It was a big study and it got a lot of bad press. And the study has since people have reviewed it, scientists have looked at it and said, wow, the conclusions that were drawn are really false. And so, what they concluded, and they had a sample of women that were much older, they used estrogen derived from horse urine. And their conclusion was hormone replacement causes cancer. Well, we know that's not true. And there have been multiple studies since then, but there is still this, myth lurking in the background, not just for women, but also for healthcare providers that they're like, I don't know. I don't think it's safe when we know without a doubt that it is quite safe to go on hormone replacement. So you're fighting culture, you're fighting media, and it's really just doing your own research now and figuring out like, is this the right option for me? Are there risks versus not doing it? And that's a conversation that you should have with your healthcare provider. But it's a lot less straightforward for women than men right now.
You know, that's such a difficult thing right now, is that like what information should I be absorbing as truth and what isn't? Because literally everything that you put on your social feed causes cancer. Like, and then if maybe somebody's misinformed in healthcare, then you have that. And then I would imagine that so you get a lot of people that are very confused.
Well, there's a lot of confusion. And also because of that study, a lot of current providers, physicians, or practitioners didn't learn how to prescribe hormones because it was like, oh, these are bad. Don't worry about it. So there's this whole re education that has to happen so that people understand what is needed and what the proper dosing is. There's a lot of different delivery methods. You can do injectables, creams, pills, pellets. Like there's so many different things and it's not a one size fits all. So you really have to work with a provider that understands the science, understands menopausal healthcare, and can get you on the right regimen for you. And for women, like once you start feeling symptoms, hot flashes, night sweats, you can't sleep, that's the time that you go have a conversation. That's when you start talking about, okay, Is it appropriate for me to do hormone replacement? Is it the right time to do hormone replacement? But what the research shows is the sooner the better in terms of, curtailing cardiovascular disease later on, Alzheimer's disease. Like, it's very protective, just like testosterone for men is very protective for your health.
So we've talked a little bit about what's going on, how to recognize it, why it's happening, but we also briefly touched on there are a lot of coping mechanisms and also things that can sabotage us. And of course, alcohol is probably one of those things. So how does alcohol interfere with those hormonal and metabolic changes that are going on?
Well, so let me back up for just kind of give a little bit of more context. A lot of women my age, we grew up with alcohol. It was our coping mechanism, especially when our kids were younger. When I've got 2 kids now and they're in college, but when they were younger, like, I could not wait till dinner so that I could have a glass of wine just to, like, let the air out of the balloon and feel like, okay, like, just take that edge off, right? My generation, like, we grew up and that was very normal. It was almost weird, right? Why aren't you having a glass of wine? What's wrong with you? And so it's a big part of your life, right? College,
Right.
raising your kids, 30s, 40s, all of it. It's a big part of the social
It's that
fabric.
question that you just said there. I'm sorry to interrupt,
No,
but I have to say it. Is that like, I mean, the generation is that, oh, you're not having wine. Why do you have a problem?
right, right. What's
Yeah.
wrong with
Yeah.
you?
Yeah.
And it's crazy, so oftentimes I always preface it with, I'm just not drinking right now. And that way we don't have to talk about this. I'm just not drinking right now. But back to your question, alcohol and you know all this, but it's such a disruptor for your metabolism, for your whole endocrine system, which produces all of your hormones. Cortisol, that stress hormone, is alcohol is fertilizer for cortisol. If you want to burn fat, alcohol is not going to be your friend. Alcohol has to be stored as fat. What I tell my clients is, if you go out to dinner and you have a steak, mashed potatoes, and a glass of red wine, your body has to deal with the red wine first, right? It has to go ahead and metabolize that because it makes toxins and our liver can't handle that. So it has to address that. Guess what happens to the rest of your meal? It gets shuttled as fat. So if you want to optimize your hormones, if you want to burn fat, alcohol is just one of those things that you've got to decide, is it worth it or not for you? And for most people, most of the time, it's a no. I wear an Aura ring. Oh, I don't have it on, but I wear an Aura ring. Are you familiar?
Yes.
Yeah. If I have alcohol, my Aura ring goes crazy. Like, what's wrong with you? What's going on? Your resting heart rate goes down, your heart rate variability goes down. It's like, you better take the day off because something's wrong. Like, your body knows, and the signals that you're getting from alcohol are very destructive. Yet, as we talked about, socially, it's such a pitfall because it's something's wrong with you, and every occasion revolves around alcohol.
That's part 1 today. In part 2, we go straight at alcohol. We'll talk why it spikes cortisol and wrecks sleep, how long recovery really lasts, and what to do instead. It starts with the line, alcohol is fertilizer for cortisol. Stay tuned for that tomorrow. This podcast is brought to you by Sunnyside, the #1 alcohol moderation platform, having helped hundreds of thousands of people cut out more than 13 million drinks since 2020. And in fact, an independent study showed that Sunnyside reduced alcohol consumption by an average of 30% in 90 days. And as one of our members shared, Sunnyside helps me stay mindful of my drinking habits. It's not super restrictive, so if I'm craving a glass of wine with dinner, I just track it and I move on with my week. If you could benefit from drinking a bit less and being more mindful of when and how much you drink, head on over to sunnyside.co to get a free 15-day trial. You'll get access to everything that we offer, including tracking and planning tools, coaching from our experts, a vibrant community of people just like you, and the motivation and advice to stay on track with your health goals, all with no pressure to quit. That's sunnyside.co.